Okay, today we're going to do the proximal fibula tib mobilization. We're going to take a dorsal or posterior glide. What you got to be careful with is we're going to palpate, take the patient, put the patient in a about 80 to 90 degree bend. She's in supine. I find the fibular head, and I'm very cautious not to get onto the common peroneal nerve. So I'm going to use my thumb and my thenar eminence as a form of mobilization. I get down into this position and I'm going to stabilize tibia, and I'm just going to do a very gentle posterior glide with fibula. Patient's in supine, she's relaxed, and I do this dorsal posterior glide. As you know, what takes place down at the ankle, when the ankle goes into dorsiflexion and plantar flexion, with dorsiflexion, we have movement because of the talus and the mortise going into and spreading the talar crural joint. It glides the fibular head in a proximal direction and also takes it into a posterior direction. So I might utilize this to help with dorsiflexion of the ankle. Then I'm going to position the patient in a quadruped position, because conversely, with plantar flexion of the ankle, it helps to glide the patient ventrally as well as distally on the fibula on tibia. So she's going to get positioned into quadruped, and I'm going to make sure that her feet are kind of off the edge so that she's in a good position. I'm going to again palpate, find the fibular head. This part of my hand is going to get onto the fibular head, and I'm going to place my hand around the femur, or it can be on the tibia. I tend to grab the femur so that I'm not pushing and moving her. From this position, I want to be very careful, and I'm going to ask input from the patient. Does that feel comfortable to you?
Yes.
Or does that hurt? Because if I create any tingling or pain in there, I may want to go a little more in a distal direction, away from the head of that femur. So I'm always being conscious of the common peroneal nerve. This also will help, as we said, to enhance plantar flexion of the ankle, because with plantar flexion we have a ventral glide of the fibular head as well as a distal glide of the fibula onto tib.